In our travels, we reach the outskirts of Montepuez, a town located in the south. There we were able to film these scenes, for which no commentary is necessary. As is true virtually throughout Africa, the hard work is done by the women and children. Nearly naked, with the little clothing given to them by different organizations, they eat but once a day, a simple tortilla. The presence of our cameras is perhaps the most important event of their lives. Malnutrition rates are alarming. The majority of the population lives below the food poverty line. They receive only 55% of the 2,200 calories a person needs daily. Infant mortality is 166.9 out of every 1,000 live births. And cholera, diarrhea, malaria, and any number of infectious diseases do the rest. The country, the streets, and the dumps are part of the impoverished life of the homeless. Nobody but a few NGOs and religious congregations comes to help them. It is not enough. Mozambique's sanitary conditions, low life expectancy, lack of access to health services and high infant mortality, malnutrition, and maternal mortality rates are all without a doubt a cause for despair. Some governments, such as Spain's, have implemented different programs to improve diet, health, and education, either alone or in conjunction with NGOs, but this is the reality. The primary focus is on children, and so Medicus Mundi is carrying out different projects to improve health conditions at Marcamu Hospital in Maputo.
The work done by Medicus Mundi at the José Macamas Hospital in Maputo, in terms of pediatrics, we provide care. That is, medical attention in the pediatrics infirmary, which has 92 beds, although generally there are many more occupants. Apart from this, we work with the other doctors in the service on scientific sessions and also on organizing the service.
Y asimismo en la organización del servicio.
For me, working with Medicus Mundi on this project has been an experience on both a personal and a professional level. Many times it also means a professional challenge, because our regular lack of materials forces you to make up for this lack with your intuition, with your clinical skills.
Te obliga a suplir esta falta de medios con aquello que puedes, con intuición o con la clínica. No tienes más medios que
you don't have any more means other than your clinical skills to treat the sick. This is a professional challenge. Apart from this, it means working on improving the quality of medicine in this country. Or at least, that's what we're trying to do.
En este país. Por lo menos eso es lo que se intenta.
Health conditions in Mozambique are another of the alarming things about the country. Really, practically 80% of the population does not have access to health services. And of course, the recent floods and malaria and cholera epidemics don't help to solve the problem.
y de cólera no ayudan a solucionar el problema.
One of the great problems is that proportionally, only a very small part of the budget is dedicated to Mozambique. In part, this is because there are no resources. Remember that in Mozambique, 70% of the GDP goes to debt payments. This money, which is used for paying off debts, could easily be dedicated to matters such as health or education, which are so necessary for the country, and which have definitely not been dealt with up to now.
The principal causes of infant mortality are malaria, diarrhea, respiratory infections, cholera, measles, tuberculosis, and tetanus. Vaccination is absolutely imperative. Children in urban areas are more vulnerable to diarrhea, cholera, and tuberculosis. And it is cause for alarm that infant mortality as a direct result of AIDS-related infections is over 20%. Dehydration is also a mortal enemy of childhood. The absence or scarcity of potable water has reached unimaginable limits. Fertility rates continue to be very high. Terminating a pregnancy is illegal in Mozambique, except when there are medical reasons. This means that at the age of 19, 40% of women are either pregnant for the first time or are already mothers. Only 61% of births are attended in urban areas, while in rural regions the figure is only 33%.
The educational system in Mozambique is truly one of the country's greatest challenges. This is not only because few resources are still being dedicated to education, but also because a significant thing holding them back is that literacy rates are very low. On average, Mozambique's literacy rate for men is 55% and 21% for women. While these figures are really quite low, there is a further problem, or an added challenge, which is that many languages are spoken in Mozambique. There is no one dominant language. While Portuguese is the official language of the country, it is really only the mother tongue of 6.5% of the population. Bringing consistency to the educational system, choosing the language of the majority while still respecting the languages of the minority, all of this is an added handicap to access, to giving boys and girls access to education. It is really one of the most important and highest priority challenges for Mozambique.
Although many are passive, some struggle to be able to study. During the several weeks we traveled through Mozambique, we saw a growing awareness among part of the population. One of the roads leading out of poverty is education. Two clear examples speak to us of this desire, not only on the part of teachers, but also on that of students, to achieve the simple goal of learning. The conditions do not matter. What is important is going to class.
Mas porque nós entendemos as nossas